This is a virus that we've been dealing with internationally. Started off kind of as a surprise, and then now it's on our shores and starting to creep into our neighborhoods. It's just a matter of time before we start seeing it locally. We're taking all the proper precautions, both from a federal and local standpoint.
All right, guys, welcome to Why Acadiana, and I'm here with the most distinguished doctor in Lafayette, right here, and my brother-in-law, Dr. Bradley Chastant, the second. And we've got, yay! And we've got our House of Representatives. We've got Jean-Paul Coussan in the House, and Charles Ditch.
Thanks for having me. Thanks for having me. It just ended up being in the office.
So guys, we're here. We're talking about coronavirus today. We've got all kinds of stuff going around, and we want to know the facts. So let's start off with Dr. Bradley. What is the coronavirus?
Well, Jim, we just did a podcast. I would refer back to that podcast for details. Now, the coronavirus.
We'll link this podcast to that podcast.
So talk right into the mic.
Yeah.
So how's that? Better? Well, this is a virus that we've been dealing with internationally. Started off kind of as a surprise, and then now it's on our shores and starting to creep into our neighborhoods. It's just a matter of time before we start seeing it locally. We're taking all the proper precautions, both from a federal and local standpoint. But the virus is a upper respiratory-like virus, very contagious. But if you take the proper precautions, like hand washing, good hand hygiene, elbow shakes instead of the handshakes, sneezing in your arms or your hands and not being uncovered, will kind of decrease the amount of transmission for this virus. Symptoms are typically pretty mild, pretty easily recoverable. Usually they start off with upper respiratory, cough, shortness of breath, fever.
Repeat that. Mild and recoverable? I thought it was like a death sentence.
No. I mean, it can be for somebody that is infirmed and ill and at high risk and immunocompromised. So there's certain populations that are be more at risk, but for us, for the sake of discussion, we're pretty low risk. If you do get symptoms, they're usually pretty mild. A little shortness of breath, a little cough, flu-like symptoms, a little low-grade fever. They're advising to stay out of the emergency room, out of walk-in clinics, out of high populous areas to decrease the rate of transmission, especially with mild and or no symptoms at all. But if you have significant symptoms, get it checked out.
Which I'm sure you probably get all kinds of people that call you with no symptoms, worried about.
Right, and so what we say, when people call, this is our little. Whenever they call the office or call on call or whatever, we ask them, look, if you've never heard of this virus and you're feeling the symptoms you're feeling right now, would you go get it checked out in the emergency room? And 9 times out of 10, the answer is no. So that's kind of my little 2 cents on it. But
cool. So why is there such a high demand for toilet paper?
I have no idea, because everybody's got garden hoses and showers in the backyard too. I don't know if people still have Sears and Roebuck catalogs and that kind of stuff. But coffee filters would fill in if you can't find.
Well, we were talking about.
You need an MD for that opinion.
It's
just, need a prescription for that.
I might make some money. There was a kid in England that got suspended from school for dishing out Purell sanitizer 1 squirt for 50 cents. And he got in trouble for that.
You gotta find that kid and hire him.
Yeah, he's got a good business mind. So
we were talking about this, like, what's gonna happen if they run out of toilet paper, and we're gonna have to start using like rags, reusable rags.
I had a lady the other day told me when she runs out of toilet paper, she's just gonna use her socks.
Yes.
So I was like,
oh my goodness. Socks. Wow.
Just a left sock, I guess.
I think I would go with like, just a small wash towel. Tissue.
Just keep it in the bathroom until.
Yeah.
Pull it inside out.
Yeah, inside out.
So, but why? So, does anybody know why toilet paper is such in high demand?
Well, I think it's because there's a question whether we ultimately get quarantined to our houses.
Right.
Okay, and so if you're quarantined to your house,
You're gonna need
like they are in Italy right now, I mean, there's people singing from their balconies, you know, to keep themselves entertained. But it's if we get quarantined to our houses, why everybody needs toilet paper. So that's
straight
the
from
basic
State
reason.
Representative Jean-Paul Coussan.
Well, it is something, it has to do with the imports. They're slowing down the imports
Right.
at the ports.
Right.
So we import toilet paper and stuff, and
Right.
I think everything's gonna start going.
Yeah, but we still got running water, you know,
Yeah.
just kind of do it Pulp Fiction style, you know, in the backyard, hose you down.
You'll be fine.
It'd be good, old bidet
Yeah.
style.
You just wash your hands.
Just wash your hands afterwards.
So, Representative Coussan, what's going on at the legislature? What is the government saying? Is this a weapon from China that they've, sent over our way? What's going on?
No, the president actually talked to the Chinese officials, and they dispelled that rumor, and
They're like, no, that's not true.
they brought in the official who had made the comment and talked to him, and basically, you know, we got to take this seriously.
Yeah.
But right now, the government declared a state of emergency. The governor, the president did, and then the governor signed an executive order yesterday. Ending all events of more than 250 people, closing public schools, and basically asked for everyone to reduce their face-to-face public interaction at the state government buildings. We're going to start basically swabbing people at the Capitol to see if they're running fever before they enter. But as of now, and we have another update at 6 o'clock tonight, we're still going to be business as usual, moving our legislation forward. Some of these things are essential, like the budget, and you know, we're going to expedite as much as we can the rest of the bills that people are asking us to pass. So right now, with schools closed, I know that's a big drain on everyone. You know, from the moms and dads at home. I have my daughter here with me today. Hey, Claire. So are you excited to be home for a month?
Yeah.
Okay. Well, the kids are.
But you're going to be homeschooling, right?
Yeah.
Yeah.
Yeah,
So reading and studying every day.
So one of the other main things that came out is that our elections for the primaries are going to be postponed. And I'm looking for it right here. It was an agreement between our Secretary of State, Kyle Ardoin, and the governor. And basically,
What elections?
we have a presidential primary
Oh, the
election coming up.
primary.
Yes. And so they want everybody to be able to take part in that. And so they're going to postpone it a couple of months, and I have the exact dates, but I'll find it here in my notes in a minute. But that's one of the big things that's happening. So government is taking decisive action, and everybody's following the doctor's orders basically on how to, and the CDC on the best way to approach it. But it is an urgent crisis, and I think everybody in Louisiana, our rate of the virus looks like we're tracking some of the exponentially higher states. I think we're at what? How many
67.
presumptive positive cases do we have now?
Presumptively positive. 67, I think, as of this afternoon. It was 51 this morning. And we're just going to see it exponentially rise and grow over the next days to weeks.
Well, and so how many do we have confirmed in like our area, Acadiana?
CDC confirmed, in Acadiana, none.
None.
But in the state, CDC confirmed but 2. But none here locally in Acadiana.
Oh, okay. So we have 2 confirmed by CDC, but then we have 67 or so that we think.
Presumptively
Which
positive.
means
It presumptively means it's suspicious for virus based on symptoms. They did the swab testing. It takes anywhere between a couple days, 4 or 5 days to come back. So they're quarantined most likely, whether in a hospital or at home. And they're waiting on the test results to come back, so that's presumptively positive. But they had a couple of them that were tested that came back negative, I believe. But I think from what I was reading a minute ago, the CDC confirmed positive was only 2 in the state.
Okay.
And the election schedule for April and May will take place in June and July.
All right.
That's what we have going on.
Well, let's talk about something that a little, not more important, but like festivals and gatherings, all the stuff that's gonna be canceled. Like Festival International, I know it's not canceled officially yet, but do you think it's gonna get canceled?
I would have to say yes.
Yeah.
But that's
Well,
we have
that's
to wait.
outside of that.
That's
April
outside of that
13th,
April 13th.
We have to
That's the
wait and see.
following
It's.
week, yeah.
I'm saying if things don't change, but I mean,
Yeah.
this is a very fluid situation. So it obviously, could be canceled. But I don't think it pays
Still
to
too
kind of.
early,
Yeah,
right?
it's still too early.
Yeah, take time to tell, and everything's changing daily, hourly, with recommendations and everything associated with this. But I mean, if you think about rate of transmission in a high crowded area, I mean it's a wildfire. That could potentially happen if we're still in the heat of things, and it's only time we'll be able to tell.
I mean, as of yesterday, 2 days ago, I didn't think they would be closing down schools.
So that was a surprise. So
Well, it was a surprise, but it was just, like I said, decisive action.
Yeah.
I mean, I started hearing it out of New Orleans because of all the cases over there, and then sure enough, from the governor, it just came out that he shut down everything. And then the Catholic, parochial, private schools followed suit.
So, I mean, but what are the chances of this being extended past
We still
the
don't know.
13th?
Right?
We just
Well,
have no knowledge.
You probably read about the flattening of the curve.
Right.
We're trying to minimize the risk of the spike so that we don't have the medical facilities being overrun. And so when you look at flattening the curve, it actually lasts longer.
Mm-hmm.
You just don't have the spike of infections.
So, and that spike is what kills the healthcare system. Like, it puts too
Right.
much pressure at the hospitals, too many people on ventilators. Because we were talking about this. You're already got a lot of patients that
In the
are
hospital.
normal.
Yeah, in the hospital for other reasons too, and So I mean, it could be availability issues, equipment issues, availability in equipment like you said, ventilators. It's gonna be a big strain on all the hospital facilities, all the clinics, all the those things.
I mean, with anxiety increasing, to kind of combat that, I mean, would you say that it's going to get worse in the next few weeks and then come down?
Yeah,
You can kind of see that in the news cycle.
I
and everything.
expect it to get worse before it gets better over the probably the next couple of days to week.
All the rhetoric in the news,
Yeah,
it's getting worse, it's getting worse.
And I think it's starting
But that's
to drift.
kind of normal to be expected.
And I think it's starting to drift a little bit this way. By probably early this coming week, we'll start seeing a couple of cases, or
But don't freak out. It's gonna,
don't freak out. I mean, we have the flu, which is much more dangerous than this, and a lot more. We deal with the flu every year, and so it's just basically the same precautions, same thing we usually see. So
would you say it's the unknown of this strand of the coronavirus that's got everybody on high alert, and the fact that it's a pandemic, which means it went global?
Mm-hmm. Yeah, I think there's a lot to do with it. And one of the unique things about this virus is one of the few that actually reach global levels because of travel, because of interaction, because of virulence, because of those kind of things. But it's going to be a lesson.
But do they know now that can you carry it and not have symptoms, and so you could infect other people and not even know that you have it?
And that's one of the theories about possibly canceling the schools, is because it obviously doesn't really affect kids all that much, if any at all. There's been no confirmed deaths of children with this, so they're thinking maybe if we can if they're possible carriers, possible vectors for this virus, maybe not keep them all together to spread it between them, and then send it home to other daycares or aftercares, or your kids visiting grandma in a nursing home, or basically spreading it throughout the community. But I mean, is that the real case? Probably no. This is just more precautionary than anything else.
Yeah, so there's a chance that people have it, they don't even know it,
Right.
and they could
Carry
give
it
it to somebody
yeah.
else. So the people who are really at threat from having this those are the older people.
The older, ill people, people that have lowered immune systems for various reasons, whether it's medications or other medical conditions that lower your immune system. Your older population statistically are over 50, 60 years old. Usually the healthy young get very mild, if any, symptoms at all.
And this strain impacts the lungs primarily.
It's a respiratory, or actually a lower respiratory airborne virus. Yeah, so it usually you see all your lower respiratory symptoms: cough, fever, shortness of breath, that kind of stuff. And sometimes it can be fairly significant that requires hospitalization. So I don't want to downplay the virus, but for the most part, it's just a run-of-the-mill type of virus that can give you symptoms. Usually it goes away on its own, but the more severe, significant symptoms obviously need to be checked out. But yeah, it is upper respiratory, it's airborne, it's an aerosolized type of transmission. But it can live on surfaces, plastics up to about 6 days or so. It can live up in the air, aerosolized up to about 3 hours. So.
Yeah, so it's got a long life on just surfaces. I mean, I was surprised to hear that, how long it can stay. And on metal or plastic or wood, it can last how many?
I think 4 to 6 days, they were saying. Yep, cardboard, all that stuff.
Yeah.
So, but no need to panic about Amazon shipping boxes and all that
Man,
stuff, though.
thank God this is not like affecting children or pregnant women.
Absolutely.
I mean, this would be a whole nother conversation. I mean, we wouldn't even be meeting right now. We'd probably be at home.
Like an ET, and don the protective suit.
That's right.
Well, let's talk about I guess real estate. I mean, do you see any canceled closings because people are concerned?
So I'm a title attorney, and we have closings come through our office with purchases of real estate. But right now, it's the refinances that are really coming in because the interest rates have gone so low because of the action of the Fed. So we're seeing another refinance boom like we saw about a decade ago.
But this is even more. The interest rate's even lower than it was.
These are historic low interest rates. So to answer your question, I haven't had any closings cancel. We have seen, the number of refis have far exceeded the number of new purchase agreements that we've seen. And I expect those to continue. I think the Fed is kind of tinkering with their interest rates right now in order to suppress the refinances for a few weeks or days. But at the same time, I feel like we'll be working on them for several weeks. So we're very busy at our office. Our office at Andrews Boudreaux is going to stay open. We feel like it's kind of our obligation and duty to continue to service our clients at a time when the financial system is basically available to them to help them in their lives and put them in a better financial footing. So we'll be open, and we just won't be doing a lot of handshaking.
Yeah.
Well, the other question a lot of people are asking, what about, and you might not be the right one to answer, but the federal loans, like rural development loans, you think with the government slowing down, you think like rural development loans are going to get pushed back, and FHA loans, VA loans?
Well, I mean, there's there's a certain amount of money that's available for those loans, right?
So I guess what he's saying is the government going to close, or
right.
are
I understand what he's saying.
Yeah.
So it hasn't happened yet, and so we're also looking at the courthouses, whether or not the courthouses remain open, because if the courthouses close, then we can't record our mortgages, which means we can't close our deals, whether it's refis or purchases. I know what you're saying. I haven't seen that action from the federal government yet, but we're keeping an eye on that, as well as the local and state government offices that we rely upon to close our deals.
Because we do have some lenders that are trying to push to close earlier with like rural development loans and stuff, because they don't know what's going to happen in the next few weeks.
Yeah, and like I said, that's the same thing we're doing with our bills at the Capitol. We're moving or expediting everything so that we can move things through the process in case we have to take a longer break at some point. Same thing with our loans. I mean, we're trying to push our loans through, get our title work done, and get things closed very quickly in the event that those types of shutdowns take place.
Yeah, and I think people need to realize, we had a client here that was concerned, I just wired my funds, I'm not going to be able to close. It's business as usual for title companies. They're closing deals right now, and unless anything changes, that's going to continue throughout the next few weeks.
I mean, we got a few agents, but we haven't seen showings slow down. I mean, people that are buying are still out there looking. I mean, that hasn't slowed down the need of homes.
However, Nicole Bringard's here. She didn't want to be on camera today, but she actually just had a client that couldn't close because they are residents in a nursing home and they've locked them down. So we had to postpone that closing until further notice. I don't know how long they're going to lock down.
The title attorney has to go get the power of attorney and be let into the building.
with the relative outside, and then we'll have to close again.
And Andrews Boudreaux's more than happy to do that.
Yeah.
You know?
Okay, so y'all are gonna make it happen. You're gonna get a power of attorney, and it's gonna go through the door and then come back out. That's interesting.
They had to think about it. They didn't know what to do because you can't get out.
But going back to interest rates, man, historic lows. We're at right now. It's up from where it was last week, and that's 3.2% as of Friday.
2.65.
On a 30-year
On a 30-year conventional, you could get up to like two almost 2.5% for a 15-year. That's insane. So it's a great, although this is an emergency, the reason they do this is to stimulate the economy when it's hurting, and we are going to go through some pain by shutting everything down. So if you are able to, we're talking about Bradley's about to refinance his house. So
Save me some money.
yeah, I mean, you can save money, you can do things to your house that you wanted to do, or you can just buy a new house, and your purchasing power is significantly more than it was a month ago. And so that's the bottom line.
I mean, it's the best time to buy a house in 20 years.
Yeah.
I mean, the purchasing power.
I don't know. Has the interest rates ever been this low? I
I think it's historic. These are historic.
I don't
lows.
think it's
Historic, yeah.
never, the interest rates have never been this low in the history of mortgages.
Yeah.
Well, we don't have a mortgage professional here, but yes, I've heard that, I've read that, and like I said, we're seeing an incredible amount of refis coming in. So you got to talk to your mortgage professional, talk to your realtors, and get those files in while the rates are here, so you can at least help your family's financial condition.
Andrews Boudreaux's open. They're ready to close some deals.
We're open when you close.
I mean, I guess it comes back if you're thinking about selling right now and you kind of pause. People are still buying houses. I mean,
Yeah.
we're showing houses, so don't get concerned about
The
people.
other thing is, I think in the next few weeks, there's going to be more people at home. There's going to be more people with more time to search for houses.
Yeah.
And so
Internet traffic.
I've already seen, our internet traffic increase on our website of people looking at homes. So
The people that would have waited during the summer are now like, well, let's do it
Well,
now.
Summer's here.
I can
Summer's
tell
here.
you, it's time. If you're thinking, if you're on the fence, you better get out there, because who knows how long it's going to be. You don't want to miss this opportunity by a month. So
Exactly.
but it's really interesting. We talk about like the festivals and things. I mean, that is going to be devastating on our economy. I mean, the festival brings in millions of dollars in people traveling here to.
And it's a fantastic time too.
Yeah, I mean,
Well,
I hope
Rhythms
that,
on the River. I mean, Downtown Alive. I mean, those will be canceled. I mean, I was supposed to gear up in a couple weeks.
how happy are the doomsday preppers right now? Like, those are the happiest people on the planet.
And there are people that are already taking those steps.
Oh yeah, look at all the stores. I mean, the stores are all. I went to go make hamburgers the other day. I couldn't find hamburger buns, but I had hot dog buns, so I just rolled out my hamburger patties and it made do with what I had. But I mean, look at all the stores. I mean, they're all wiped out.
So I mean, you think this is gonna be a year on? I mean, we're gonna have to get a corona flu vaccination, like the flu shot.
That's all in the works, and probably wouldn't be a bad idea. Just like people get vaccinated for pneumonia and influenza and all that stuff too.
But well, how come like the flu, you can get a flu shot but still get the flu?
There's different strains of the flu. There's a
So
bunch of
that's
different
only
strains.
just a few strands.
Right. They calculate what they call the genetic drift on an annual basis through the CDC, and they see which one's the more prevalent strains of the virus is going around through the United States or internationally, and they formulate the vaccination based on those particular strains. So you can be vaccinated against 24 different strains. You may get the 27th strain of the flu, whether it's flu A or flu B, and it's just it's a calculated formulation.
Mm-hmm.
So, but you can.
How do they make that? Like, how do they come about making the flu vaccine? Like, what are they waiting for to make the one to fix this? I mean,
Well, so they take all the information from that year of incidence of influenza A, influenza B, or different strains, whether it's the Australian something other flu strain. They actually threw that one in this go around because that was a little more popular one over the last couple of years. So it's all calculated. It's there's tons of different strains of various viruses, and the more deadlier ones like the H1N1 swine flu and all that. That's in every one of the influenza vaccinations. My wife got influenza A, likely H1N1, about a month and a half ago. She was sick, but we caught it early, treated it, and she did have the flu shot. And just if she wouldn't have had the flu shot, it possibly would have been that much worse.
Really? So it helps.
Oh,
It's not the same strain.
Absolutely.
Well,
Absolutely.
would I guess they don't know yet, but would the flu shot help with the coronavirus?
No.
No. Okay. It's totally
Completely different species of virus.
All right.
So coronavirus is shaped like a crown, and influenza virus is the influenza virus, and so completely different species
so-
of virus.
Speaking about that, like, what's the treatment for coronavirus? For a healthy person.
Right now, there's no specific medical treatment except for symptomatic treatment. Whether it's over-the-counter, Tylenol products, acetaminophen, Motrin, ibuprofen to keep fever down and the chills down, etc. And also keep well hydrated, fluids, and more fluids, and
Vitamin C.
Vitamin C, yeah. I mean,
So,
vitamin C is in it.
so the people that have tested positive, what's how sick are they for how long? Like, is it a week and they're done, or is it 24 hours they're done? Like
That
have you
specific time frame, I'm unsure of. It's I guess I just use the example of the flu a lot. People get the flu and they get symptoms for about a week and a half. So it's probably very similar to that. But the people that do contract it, their symptoms are usually pretty mild, if any at all. And so we urge those guys again to stay out of contact with the general population, whether it's in the hospitals, nursing homes, big congregations, that stuff. But this more severe cases, obviously, we've seen reports throughout the country, internationally. There have been some reported deaths, just like with influenza, just like with any other kind of virus. It could potentially do that, but those more severe cases need to be checked out, and that's high fever, significant shortness of breath, cough that is worsening the shortness of breath. So get those checked out.
Yeah, so I think they have like breathing, like machines and stuff. If you got severe, if you're an
Right.
elderly person.
Yeah, a lot of people end up having to be put on a ventilator in extreme cases. So.
okay?
So what's happening? What else about like office closures do you think? Is it something that we all should start closing our offices and telling people to go home, or should we be doing business? Or
The recommendation right now is business as usual, and obviously, take
the only
precautions.
the only thing is you got parents that have to go home,
Right.
but what do they do in the summer? But I guess you'd send your kids to camp in the summer and take care of them. It's going to be a challenge. It's going to be. This is like never happened in the history.
We're doing this for the at-risk population.
Right.
I mean, that's what we're doing this for, and I think it's a small price to pay. The inconvenience to save those lives. However, there's the healthcare side and there's the economic side, and that economic side is something that I don't think we've quantified just yet.
Yeah, it's going to be huge.
And you're right. I mean, it's to save lives, but also it's we don't expect to eradicate it. It's to save lives and to like decrease that spike in that bell curve so that it doesn't overpopulate our hospitals, and then that's when people can die without treatment because you don't have enough breathing machines and ventilators.
Run out of tests.
Yeah, run out of tests, right?
Well, so what's the implication of the president making a national emergency and then the governor? I mean, I know it's financial money behind actually doing that. So what do you see in the state?
What does that mean?
The president's declaration opened up $50 billion available, making it available to the states. It also had immediate impact on a lot of regulations that were slowing the supply chain of goods, and also some of the bureaucratic red tape that hospitals have to use or have to go through in order to rent space. Something easy as that: hire new physicians, get new medical staff, get nurses. So he basically loosened up all those bureaucratic issues through his declaration so that we can get people treated as quickly as possible with the best possible outcomes. Now, then the state is now responding to all the cases that we have, and it's going to be expensive. And same thing, we need all the people on hand, and so we're going to be able to draw down federal dollars from that. But like I said, we also have state legislation. We have our own issues down here that we have to deal with, from elections to the budget, and down to schools. All of the governor's declaration impacted all of those things.
How much of that do you know, or do you potentially have?
Yeah, I've read the same thing. You know, his
Is it payroll taxes and obviously
some of
taxes?
his. So look, if they waive payroll taxes, I think that would be fantastic, a fantastic stimulus. But from what I understand, is that some of his advisors are still saying are
You
against
can't
it.
do that.
Well, no, possibly they could, but they'd have to have legislation signed by everyone. But I'm just saying, I'm not sure that his advisors are on board with it right now. So it's just rumors.
Well, also that April's tax month. I mean, we're gonna have to extend that. I mean, there's no way that everybody's gonna be able to get
That's a
their
good
taxes
point.
done.
Yeah.
I mean, you got
Absolutely.
CPAs with that are run by moms, and they're not gonna be able to be at work because they got their kids at home. It's gonna be interesting to see what happens. They're gonna extend that. That'll help people for a little bit, keep their cash, and keep things going at least.
I saw the city of Lafayette waive late fees and termination of service for LUS customers temporarily for the next 60 days.
Oh no.
So the mayor took that action this morning.
Okay, I didn't know that.
Mm-hmm.
It's gonna be interesting. It's just like I think a lot of people are freaking out because there's not a lot of information out there for them to.
It's a new novel thing.
Yeah.
Well, I hope that they have a plan, Jean Paul. I hope, like the governor, I mean, obviously they have some type of strategy in place with this, and they didn't just obviously say, oh, we should shut down the school and shut it down. You would hope that in the next few days or weeks, they start telling us, like, what's going to happen with the kids for spring break. Are they going to add spring break to that? Or, a lot of moms are like, man, the week we go back, Nicole, I think you told me, the week you go back to school on April 13th, then spring break starts, and then what happens with all the seniors who are graduating? Are they going to get pushed back into the summer, and then that affects the whole, travel and tourism and everything because people have trips planned.
So the governor's remarks today basically said there's no reason to believe that what has happened in Italy can't happen here, which was the spike. We need an appropriate sense of urgency about this epidemic and our response. Washington State is 10 days ahead of us. Our situation in 10 days could be very well like theirs is now. Our urgent priorities are to minimize transmission, and to increase health system capacity. He gives out the numbers for the COVID-19 questions, and then basically all the different agencies of government are meeting more than multiple times a day through the unified command with the governor's office of Homeland Security to strategize and to operate. That comes from the Office of Public Health. GOSEP meets with FEMA. The state agencies are all on board. Basically the message is that this is urgent. We need to maintain that sense of urgency, and we want local officials and other leaders to take their cues from them in maintaining a sense of urgency about the epidemic. So there is
What's
a plan.
happening in Washington State? He said that there's no reason we wouldn't be like Washington.
Washington
What
State.
they're ahead of it, just like Italy's like 2 weeks ahead of the United States. So
China's 6 months.
that's why everybody's saying in the next few weeks it's gonna get worse. The spike's gonna get worse.
Washington's curve
Went straight up.
has gone straight up. We're tracking close to the New York as far as the number of cases versus the number of days since it was
But-
first transmitted.
I'm looking at this,
And so you see
and if
Washington's
you can see
over
it,
there.
yeah, I mean, if you can see it though, like the good news is all of it is under 100. There's less than 100 people in all of those states with it, which is, or I don't know if that's presumptive.
Well,
or-
that's the number of days, but that's also because the number of days since the first transmission is still
Right.
between 0 and 10 days. So here we are in Washington, which was 40 days, and Washington's way up here, on the curve with over 600. So that's what we're saying is we're jumping ahead of it so that we can
So-
not have that exponential.
What is, Bradley, have y'all been talking about like what is the threshold of that Louisiana can take in the medical industry? I mean, is it like how many people can you guys handle if we get 100 or 200 cases in Acadiana? Is that doable or is that like extreme?
I mean, we'll do what we have to do, and only time will tell. And I mean, we'll see. We'll see. I mean, obviously the system's going to be strained, but we'll make it happen.
Like you just came back from the hospital now, and obviously it really hasn't hit us yet. how packed is the hospital today with nobody with the coronavirus in it?
It's, I mean, like we talked about, it's business as usual. So, I mean, people get sick for various reasons and they're hospitalized for various reasons. Hospitals, for the sake of discussion, are usually pretty packed. But
So it's already full, so any more people?
right.
on
So
the-
what we've been discussing too is the potential for like elective surgeries. You know, somebody that needs a hip replacement or knee replacement, but is not emergent. We're going to possibly, depending on how things go, might have to postpone those to keep beds available for the ones that need it. You know, so
Right.
obviously the ones that need it. But you know, if we can kind of keep down the elective reasons to be in the hospital, then we, you know, we'll do what we got to do. But I mean, that's going to be up to the administration, to you know, all the powers that be. But
So one of the cool things is, because we're about to roll up, but you know, if you do have symptoms, don't go to the emergency room, right?
let your provider know. Mild
By calling
symptoms
them.
by calling them. Don't show up at their office. Call them. Be careful with walk-in clinics, emergency rooms. If you're very mildly symptomatic, you know, most of the time it's just recommended quarantine for up to 10 to 14 days. Again, we use the saying, if you've never heard of this virus and you think you need to go to the emergency room, do you think you need to go to or if you feel the way you feel, do you think you need to go to the emergency room? So kind of take it with that being said, and but I mean, mild cases usually run the course. Significant severe cases of shortness of breath, high fevers, get it checked out. But we need the least amount of exposure as possible to decrease the amount of spread of this thing.
Awesome. Any final words, guys? No, Paul? I know you got a roll. So
Maintain a sense of urgency.
I say take the opportunity, call your grandparents, say hi, check up on them.
Tell me low.
Check if you got any old neighbors, check up on them, just say hi.
Yeah, you know, as a community, we're gonna we're gonna band together and get through this.
All right, fellas. Thank you guys so much for being on our show. And I know you got a lot of work to do, and I know you're about to get hit hard, man. Thank you for being here. All right, we're out.
Thank you.
Peace.
Thank you, Jim.